Hi, this is Jessica DeMassa, and I'm here with Kent Ivanoff. He is the CEO and co-founder of VisitPay. So welcome, Kent.
Thank you so much.
Thanks. Let me know a little bit about VisitPay real fast.
Yeah, VisitPay is a patient engagement platform for the billing side of healthcare, the financial side of healthcare.
Okay, why is it important for us to address this side of healthcare in particular? I don't think I've run across anybody who's got a solution for this yet.
Yeah, I mean, it's a huge issue, right, for consumers. And at the end of the day, the burden to consumers is bigger than it's ever been before, and it's just continuing to grow. And consumers need help. And frankly, hospitals and health systems and other providers need help managing this new dynamic that they've never had to contend with before.
Okay, so are you working with insurance? Are you working with self-pay patients? Or how are you, what are you doing exactly with VisitPay?
Yeah, what we do is our client is typically a major health system provider.
Okay.
And what we typically do is take over the billing interaction model with consumers, especially as it pertains to a digital model.
Okay. Can you say that again in English?
Yeah, sorry about that. Yeah. So,
it's okay.
Yeah, so if a consumer wanted to pay, actually to consolidate his household or her household into one account,
okay,
and manage that relationship with the health system through one portal.
Okay.
That's what we do.
So if I wanted to pay all my doctor's bills in one portal,
that's right,
I can just do it through VisitPay.
That's right, for your whole family.
For my whole family. Fantastic.
Yep.
Okay, very cool. And from a consumer standpoint, why is this important?
Yeah. Consumers need help on two fronts. One, they don't understand their bills, right? We confuse the heck out of consumers. And so one of the things we do is present an explanation of benefits, for example, from their insurance company, right alongside their provider bill. So they know exactly what insurance is paid, how is it paid, and why they owe what they owe, or right, the provider's saying they owe. So that's one reason, is people need to understand their health care. The second reason is, with the average household in the United States at $57,000 a year, but the rise of high deductible health plans, patients are facing bills they've never had to contend with before,
right,
and they need help paying over time. And so our platform enables the hospital to provide financing to consumers in a way that's really consumer friendly, really low cost, oftentimes free, usually free, but allows consumers to design a plan that works for them and their family.
I want to go back to what you said about consumers not understanding a lot of times what they're being billed for.
Right.
How important do you think health literacy is, I guess, as an industry-wide issue in terms of better educating patients and making healthcare in general just better and more efficient?
Yeah, I think the best artifact of why it's broken or how it's broken is the rise of high deductible health plans. Consumers are buying down their premium. And what they're doing is getting a plan that has not that much coverage, or
right,
a big financial obligation before coverage takes place. And yet they're probably the same people that are least capable of affording that big obligation when an unexpected event happens. And so I think financial literacy is a huge issue in healthcare, and one that we all need to address.
How do we do that? What do you do? How do you teach people how to buy healthcare?
Yeah, I mean, that's probably outside my pay grade. That's well beyond what we do. What we do is say, after you've purchased that plan from that insurance company, or on the exchange, or through your employer, what we do is help you manage the financial aftermath of that.
Okay.
Frankly, in terms of if you need help, if you get sick, if a member of your family needs care, we help the hospital provide a solution for you that works for your budget.
And we've been hearing, and I'm just curious from your vantage point, you're on the back end, and we've been talking to a lot of different people about price transparency on the front end.
Right.
What are you feeling? What are the repercussions by the time, the service has been delivered and there is the lack of price transparency, or maybe it's getting better? I mean, what are you seeing when you reach the patients at the point of your service where it's the bill is due? Right.
Yeah, we actually do back end, but we also do the front end.
Okay.
And so we will take an estimate from, say, whatever health system's estimating tool that they may use, right? Then there's any number of those, and we will bring that to the consumer, and then from that estimate, allow them to, frankly, get some peace of mind about how they're going to contend with this massive balance they may have for a hip replacement, for a knee surgery, for the birth of a child, right? All the things that we face every day as healthcare consumers. It's one thing to know what it's going to cost, and usually those estimates aren't that great, frankly. But to have peace of mind that if the estimate is higher or lower, I'm going to be able to deal with that change after the fact, but on terms that matter to me.
Do you think, I mean, and this might be, again, more of a macro kind of viewpoint that we're looking to elicit from you, but in terms of like the payment model, things are still starting to shift there. And I know that there's increasing focus in the health innovation community about finding new payment models.
Yeah.
If that happens, how does that impact, I guess, some of these challenges that you're specifically working to overcome?
Yeah, I don't see a day where consumers aren't on the hook for an ever-increasing share of their healthcare expenditures, right? I think a natural reaction of the Affordable Care Act was that insurance companies lost the ability to underwrite at some level, right? And so the only way they could contend with that new dynamic is to put burden to consumers. But because consumers don't pay healthcare bills very well, that burden shifted to providers. And so it's a dynamic that actually works in the healthcare market if you're an insurance company. It doesn't work so well if you're a provider. And frankly, it doesn't work so well if you're a consumer. So there's always going to be a need, no matter what that payment model may look like, whether we go from fee-for-service to fee-for-value next year, which is not going to happen,
right,
or 10 years from now or sometime over that time period. I just can't imagine a world where consumers aren't in the driver's seat from patients aren't in the driver's seat from a consumer perspective, and because they're going to have a big stake in their care.
What's your best advice then for the consumer patient? And what's your best advice? What should we be doing?
Yeah, I think one thing is buy a plan not just on the premium, but on the coverage, right?
Okay.
Understand the coverage. Make your own assessments of how much risk you're willing to take and whether or not you can contend with that. And then if you are going to have a high deductible plan or have less coverage, make sure that you're working with a provider that can actually help you deal with the financial ramifications of that, because providers have skin in that game too.
Very good. All right, last question for you. We're going to ask you about your WTF health moment where you're wondering, things are so terrible. WTF, what's the future? The future has to be better than this.
Yeah, I mean, I think I'm optimistic about the future. I think bringing consumers into the mix is going to force a new equation, a new conversation between providers and payers and employers. And I think that's probably long overdue. And there's going to be ample opportunities for companies like mine, like others, to come in and help solve this new dynamic in a way that's great for consumers, great for providers, and great for payers. It's just going to be different, but it doesn't mean it can't be great.
Right. Well, Kent, thank you so much for sharing your perspective with us. It was a pleasure to speak with you.
Thanks, Jess.
Thanks so much. This is Jessica DeMassa. Thanks.